Hey, what's up guys? It's me, ThePsychNPDavidC. So today I'm going to be counting down the top 5 antidepressants that I use for my clinical practice. Keep in mind there's no such thing as a perfect antidepressant. Each antidepressant comes with its own strengths, weaknesses, side effects, but these 5 rise to the top for their effectiveness, tolerability, and versatility. So before we start, I just want to remind everybody that this video is for educational purposes only and is not meant to be medical advice. This list is my own personal opinion. Now with that said, let's talk about it. Okay, so starting with number 5, we have mirtazapine or Remeron. So as you may know, there's like many different classes of antidepressants, and Remeron belongs in the other category. That's because it works differently than most other antidepressants on neurotransmitters, which we won't go into detail in this video. But anyway, the reason I like Remeron is because its side effects can actually be used strategically. The main 2 side effects of Remeron are increased appetite and sleepiness. As you can imagine, those 2 side effects for most patients can be problematic, but for other patients, they're actually an advantage. For example, if there's a patient who suffers from insomnia, then the sleepiness side effect can actually be a benefit. So it would help them get more sleep and also help with any other depressive symptoms they may be having. And the same thing goes for the increased appetite side effect. If someone who's depressed and they're not eating as much because of it, then Remeron could be a good option for them. For the most part, I only prescribe Remeron when a patient is having both of those symptoms, like they're not sleeping and they're not eating as much. From my personal experience, it's more often used in the elderly population, but I also use it in adults aged 18 and up if I feel like they can benefit from it. It's supposed to be taken once a day at nighttime before you sleep because of that sleepiness side effect. There is kind of this weird caveat with that though. Like supposedly it's more sedating at a lower dose than it is at a higher dose. And moving on to number 4, we have fluoxetine or Prozac. So Prozac is one of the most known antidepressants that has been around for decades. What sets it apart from the other antidepressants is that it has a really long half-life, which means it takes longer for it to get out of your system. Speaking very generally, other antidepressants take about 2 weeks to get completely out of your system, while Prozac takes about 5 to 6 weeks. So why is this a good thing? It means if there's a patient who often forgets to take their medications, Prozac is actually a really good option for them because its long half-life means there's a more stable level of the drug in somebody's system even if they miss a dose or 2. And the long half-life also reduces the risk of withdrawal or discontinuation symptoms. Another fact about Prozac is that it's the only FDA-approved antidepressant for treating bulimia. So if I have a patient who's struggling with depression and bulimia, then I'd probably start them on Prozac first. Also, another fun fact is that it's one of 2 antidepressants that are FDA approved for depression in adolescents. So I have fluoxetine or Prozac at number 4 because its long half-life can help patients who forget to take their medications. And moving on to number 3, we have bupropion or Wellbutrin. So most antidepressants boost serotonin, but Wellbutrin is actually unique in that it actually boosts norepinephrine and dopamine. That means Wellbutrin is useful for patients who have like low energy, low motivation, and difficulty concentrating. It's known as the activating antidepressant because it's supposed to like activate your body. Another good thing about Wellbutrin is that it's supposed to have less sexual side effects. Other antidepressants like SSRIs usually have a side effect that lowers a person's libido. It's actually a pretty common reason as to why a lot of my patients don't like taking SSRIs because they find that it lowers their sex drive. So Wellbutrin is a good option for patients who have that concern. There's also some off-label uses that Wellbutrin is good for. Like for one, it's used off-label for weight loss. Number 2, it's used off-label for ADHD because it helps people concentrate. And number 3, it can actually also be used for smoking cessation. However, there are a few downsides to Wellbutrin. The first being that it doesn't treat anxiety. A lot of other antidepressants treat both depression and anxiety, but Wellbutrin only treats depression. As a matter of fact, anxiety is actually one of the side effects of Wellbutrin, just because it stimulates your body so much that you might get anxious. Another downside to Wellbutrin is that it lowers the seizure threshold, basically meaning that it increases the risk of someone having a seizure. So if there's a patient with like a history of seizure disorder or a history of eating disorder, I would definitely avoid Wellbutrin because of that fact. But overall, Wellbutrin earns my number 3 spot because it helps a lot with energy, concentration, and motivation. And at number 2, we have escitalopram or Lexapro. Lexapro is one of my favorite antidepressants just because of its clean side effects profile and overall ease of use. It's FDA approved for both major depressive disorder and generalized anxiety disorder, which are 2 of the most common diagnoses I see in my patients. Many of my patients describe Lexapro as like subtle in a good way. Like it helps them with their anxiety and their mood without making them feel too much like they're flat or foggy. Lexapro has very few medication interactions, so it makes it useful for patients who are taking a lot of other medications. Generally, if I encounter an elderly patient who's taking many medications and they need a medication that helps with depression and anxiety, I'll often choose Lexapro first. Lexapro has side effects like nausea, headache, and the sexual side effects that we discussed earlier, but they're usually either temporary or manageable. So Lexapro earns my number 2 spot because it's FDA approved for 2 of the most common diagnoses I see in my patients, and for its minimal medication interactions. And finally, at number 1, we have sertraline or Zoloft. Zoloft is my most commonly prescribed antidepressant by far. It's effective for many different psychiatric conditions. Its side effects are usually very tolerable, and it's just very flexible overall. So Zoloft is not only FDA approved for major depressive disorder, but also OCD, panic disorder, social anxiety, and even PTSD. It's generally very well tolerated. A lot of my patients say they'll have like nausea or diarrhea that lasts like a week or 2, and then it completely goes away. Also, compared to other antidepressants, it can actually be less sedating and cause less weight gain, which makes it easier for people to function throughout the day. Also, the dosing of Zoloft is very flexible. For the most part, it can go up to 200 milligrams. So I can start somebody off at 25 milligrams and then go to 50 milligrams, 75, 100, 125, etc. So it provides a lot of wiggle room to play around with the dose. Some of my patients do great at 50 milligrams, and some others do great at like 175 milligrams. And Zoloft is also one of the most safest antidepressants to use when breastfeeding. So yeah, sertraline or Zoloft earns my number 1 spot just because it's super easy to use. It's effective at a wide range of psychiatric conditions. It has very good tolerability when it comes to side effects. It's just very versatile. I would guess somewhere around 75% of my patients who are on an antidepressant are on Zoloft. So to recap, here's my top 5 personal favorite antidepressants, counting down from 5 to 1. Number 5, mirtazapine or Remeron, which is great for patients with insomnia or low appetite. Number 4, fluoxetine or Prozac, which is great for patients who forget to take their medications. Number 3, bupropion or Wellbutrin, which is good for patients who are depressed but not necessarily anxious because it boosts energy, motivation, and concentration. Number 2, escitalopram or Lexapro for its minimal medication interactions. And number 1, sertraline or Zoloft for its broad indications, clean side effect profile, and just versatility. So remember, this list isn't about which medication is best overall. It's about matching the right medication to the right patient based on their unique symptoms, comorbidities, and preferences. 2 patients with the same diagnosis can respond very differently to the same medication. The key is personalization. Have you had any experiences with any antidepressants on this list? Let me know in the comments down below. If you found this video helpful, make sure to like and subscribe. I am also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. I do telehealth medication management for adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up. You're welcome.